want you to imagine that the most important person in your life has died, and how that would feel. Pain, stress, maybe the anger, and how hard that would be. So hard, in fact, that you're not sure that this is an obstacle that you can overcome. And on a particularly bad night, you call your friend and you tell her that you would rather die than live without that person for another day. And feeling embarrassed, you hang up the phone, and some time passes before you notice the glow of a police cruiser outside of your house. You hear a knock at your door and look out your window, and you see two officers standing there. Now, you were already stressed. And can you imagine, after everything that's happened that night already, the tension of seeing those officers standing there? So you go to them and you ask them what's wrong. And they tell you that they received a call from your friend, warning of a possible suicide attempt at your address. And you try to wave them away, you say, it was just a bad moment, I'm fine. It's really okay, I'll be all right. But these officers have been on a lot of calls before. And they know that if they leave, they can't be sure that you're going to be okay. And so they tell you that they're going to transport you to the hospital for an assessment. And as you're being led down to the waiting police cruiser, you can see your neighbors looking out their windows, watching you being put into the back of that car. And they drive you to the hospital, and when they get there, they take you out, you're walked into the emergency department. You sit down and you wait. You wait for hours, under police guard, and in full view of your community. And you can see the people looking at you, and looking at the armed police officers sitting on either side of you. You can imagine what they must be thinking. What did you do that was so bad that you had to be brought in by police officers? How embarrassing that must be. And finally, you get to talk to the doctor, and when you talk to him, you tell him the same thing that you told those police officers. You say, you know what, I'm fine, really. It's okay. It's just a misunderstanding. Just let me go home. And after talking for a while, the doctor tells you that he agrees. He thinks you're going to be okay. They don't have a bed available, so they're going to send you back home. And with that, you're discharged from the hospital. The officers are driving you back home, and you can feel their frustration. That after all of that effort, they know you're probably not going to get the support that you need. And so they do the only thing left that they can do. They help you out of the car, and they give you a card with their number on it. They say, if you have any other problems, give us a call. We'll be right back. You go back into your house, the door closes behind you, and you are right back where you started. Over the past several years, Canadian police have been under intense scrutiny for the way that they respond to mental health calls, especially in cases where the person has entered into a critically distressed state, and the end result has been a use of force and sometimes a loss of life. And when this occurs, the public becomes intensely concerned with police training and police protocol, and reasonably so. But the question that is not being asked is, why did that crisis call happen in the first place? Why wasn't that person helped before they reached a point that would put them in contact with police? What we don't see is that these calls that end in tragedy are the symptom of a much larger problem. That the lack of mental health support in our community is driving our vulnerable populations into contact with police, law enforcement organizations, never meant to provide health care. And if we want this to change, we need to look at ways of preventing those crisis calls from happening in the first place. We need to help that person before, not after they've already gone into crisis, by providing better supports in our community and better tools for our officers to use out in the field. But in order to do that, we need to have a better understanding of the type of people that we're trying to help. Now, if I had you imagine a crisis call, what would you see? If you're like I was before I started working in this field, you're probably thinking of three things right now. Someone who is aggressive, someone who is armed, and someone who is psychotic. In my undergrad, I co-founded a company called Health I Am with my friend Daniel McKenzie. We've been working with an international research body called INTRI to help police officers when they're responding to these calls. And over the past few years, we've been involved in over 13,000 of these mental health crises calls. What we've seen on these calls is that the people that the officers are interacting with are very rarely like the people that we see in the news and media. So this is our population sample of those 13,000 calls. First, we'll filter it down to include only those who are showing any kind of aggressive behavior. Then to only include those who are also carrying a weapon. Finally, those that were also psychotic. And what we're left with is 5%. 5% of police mental health calls fit that stereotype. And so reasonably, you may be wondering, well, what's happening in the other 95% of calls? Well, let's ask a more specific question. How many of these calls involve people like me or like you? Now, to do this, I need to make a few assumptions about you. The first is that you're not violent people. The second is that you don't carry a weapon. And finally, that you're not homeless. And what we're left with is 50% of calls. These are not people that are threats to society. This is a mother who has lost her child, a man who is going through a tough divorce, or a student who is failing all of their courses and can't cope with that stress. And in almost every case, it is a person who has needed our help, but in the absence of that, the police were the ones who had intervened. Our officers are stemming a tide of mental health needs that are not being met. They're responding to calls like this every single day, and in most communities, they have a choice that is limited to two options. One, leave the person on the scene and hope that they get help on their own, which really isn't an option at all. Or two, take that person to the hospital. Now, if you're mourning the loss of a loved one, a trip to the hospital might not be what you need. But if the officers leave and you were to later harm yourself, they're the ones who take the blame. Why didn't they help you? Why didn't they do something? And so what we see across Canada is communities where officers almost exclusively elect to transport people to the hospital. In many cases, knowing that that person won't be admitted, but not having a better alternative. These folks that the officers are bringing in are admitted less than 40% of the time. Now, this is very frustrating for the officers because they know despite their efforts, that person's not going to get the support that they need likely. And it's also very frustrating on the hospital side because they know that person isn't there because they're fit with the hospital services. They're there because the officers don't have another option. And it's extremely hard on the patient as well. We had one community tell us about a case where the officers were waiting for literally days in the emergency department with that individual, to the point that they started going and taking turns getting takeout food for that person that was waiting back at the key. On the flip side of this, we've heard from hospital administrators who've told us that they're closing their gift shops and the training rooms for their staff to make room for more beds because they are always over capacity. You see, in most cases, if we want to admit someone that was brought in by the police, we need to discharge someone else back out into the community. In other communities, officers have a 2-day drive just to get to the hospital. And when they get there, there's no guarantee that that person will actually be admitted. This is extraordinarily expensive, both in terms of the financial cost to the police and the health services, but also the social cost to that patient, to their friends and family, to you. This is a person who has endured the extreme stress of a mental health apprehension and now has to reintegrate back into their community as if nothing has happened. And tell their friends and family, or maybe their boss at work, why they disappeared for 4 days without warning. And what we've seen is that this is a system that does not work. Instead, it has given rise to something that has been called the revolving door, a cyclical process in which a person goes into crisis, seen by the police, brought to hospital, and is discharged back out into the community. And this happens again, again, and again. There's a community less than an hour away from here in which a single individual responded to 300 times per year. That is over 300 calls to fire, EMS, and police services every single year. Now, what we have today is far from perfect, but it is an improvement over the way things used to be done. You see, to understand where we are today and where we might be going, you need to understand where we came from. In 1841, Ontario opened its first asylum at what is now the site of the Centre for Addictions and Mental Health in Toronto. This marked the beginning of over a century of mental health care that was fiercely criticized for mistreating and incarcerating our vulnerable populations. And in the 1960s, we as a society decided that this was unacceptable. We began to close our asylums. But that closure came with a promise that instead of institutionalization, we would provide high-quality care out in the community. Well, we closed our asylums, but those new supporting measures were never fully put in place. Now, if I had you choose between a doctor, a police officer, or a social worker to provide mental health care, your first choice would likely not be that police officer. But the system that we have created has made our officers the de facto first responders to mental health needs in the community. And this wasn't deliberate. There wasn't planning done to make this happen. And for a while after these closures, the public and the police didn't really want to acknowledge that this was even a problem. But as a result of this situation, our officers are now our primary caregivers for mental health needs, though they were never given the mandate or the tools to do that job. We are now seeing a dramatic shift that is blurring the lines between our police, hospitals, fire, and EMS services. And our officers, the people who are on the streets, are adapting to this change. When asked to rank the importance of the emotional intelligence training that they now receive as part of their training, literally 100% ranked it as extremely important. The education level of our officers is changing as well now too. Over 82% have post-secondary education, and they're coming from more diverse backgrounds like humanities, social work, and psychology. Police policy has changed as well now too. This is a picture of Jamie and Angie from the Brantford Mobile Crisis Rapid Response Team. Now, Jamie is an officer from the Brantford Police Service, and Angie is a mental health specialist from St. Leonard's Community Services. And they ride together every single day with the sole purpose of helping people who have mental health needs. Now, these are two of the most incredible people that I've ever met. Say if you've had an assault, and every single year on the anniversary date of that assault, you go into crisis. With your permission, these two will come to your house, they'll check up on you, they'll make sure that you have the support that you need to get through that tough day. And we've met many others like Jamie and Angie. But what is still missing is well-resourced mental health options for officers to use out in the field. We had one officer talk to us about a time where he was trying to find detox services for an individual he was working with. They searched within a 100-kilometer radius, which included 6 of Ontario's 10 largest population centers, and they couldn't find a single bed. If we expect our officers to be social workers, geriatric consultants, addictions counselors, and mental health specialists, in addition to their role as law enforcement officers, we need to at least give them the tools to do that job. We can't allow ourselves to only participate in the conversation once things have gone wrong. What we're seeing now is passionate people working in policing, healthcare, education, supportive housing, and more that are breaking down the traditional barriers between their organizations and working together. And we've seen how effective it can be when the police are put into contact with other resources in their community that they can leverage. But these new programs come with a price tag, and that can often scare people. As a society, we are often guilty of comparing the cost of a new program to zero, where in reality, the cost of making the same mistakes again and again is much worse. In the communities that we've worked with that have invested in new programs like the mobile crisis teams, we have seen a 4-to-1 return on invested tax dollars. But more importantly, we've seen a more effective, a more empathetic, and a more caring mental health system. Your friends and family need you to help us make good on the promises we made when we closed our asylums in the 60s. You all know someone who has been affected by mental health. They deserve better support. Your friends and family deserve better support. You deserve better support. And you have the power to make that happen with your votes. When you vote for your city councillor, for your premier, for your prime minister, look for the individuals that have the courage to invest in the change that needs to happen. After our travels across Canada, I firmly believe that we are positioned to become an international gold standard in mental health care. The power to make that happen is with you.